Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Very excited this morning to bring on one of our delightful partners, Miss Lisa Kopp with Hope Pace. How are you this morning, Lisa?
I'm well, Amanda. Thank you.
Well, I know you can talk about this program forever, so I will just ask you this one question and let you go to town. What is Hope Pace and how do you qualify for it?
Okay, so Hope Pace is PACE stands for Program of All-Inclusive Care for the Elderly. And what we are designed to do is to work with our older adult population who could be at risk for possibly going into an assisted living or a long-term care facility down the road. But if we can determine these folks can live safely in their homes and we bring them into our program, we're going to do everything we can to age them in the home. So we refer to PACE as a center-based program because one of the stipulations with PACE is that we have our own providers. So the folks receive their primary care and a lot of their medical care in our PACE centers, which are located in Lee, Collier, and Charlotte counties. And normally how this program works pre-pandemic, because things are a little different right now, is we do require these people to attend the PACE center at least once a week. So how it would work is, let's just use Monday as an example, that Mary goes to PACE. The bus would go out in the morning. We would pick Mary up. We would bring her to the center. There she would be with the same group of people. So that enables her to get socialization, which we know a lot of our seniors are lacking, especially now with the pandemic, as well as providing activities. There's physical therapy that's available, and that is where their doctors are. So if they are due for any annual assessments, blood work, things like that, that normally would be done on their scheduled center day. We do provide meals. We have a breakfast snack that's offered, and we do provide a hot lunch. And the meals are overseen by our dietary staff because we do have some folks that have some dietary restrictions, and we have been able to accommodate. Sometimes there's music that's offered in the afternoon, and then we put them back on the buses and then we bring them out. But the nice part about the participants coming to the center is it does enable the caregivers to get that much needed break that they need, because this program isn't just designed to take care of the participant, it's also designed to give that much needed support to the family. So that is the center. Now, we also provide specialists, medications, home health aid services, medical equipment. And the way that all works is the team of professionals that are taking care of our folks together collaborate on what services and what medical interventions are needed for that individual. So if the team feels someone needs to see a specialist, we would actually make that appointment. And for those participants that aren't able to drive, we can take them to those appointments. We also will have the medications come directly to the home. They're pre-dosed, which enables those folks that have some medication management issues that can help take care of that situation. And then the home health aides go in, and what they will do is they'll provide personal care, light housekeeping. They can take them to do errands. So that's another opportunity for some of these isolated individuals to be able to get out in the community. We are also available 24/7. So one of the things that we really try to do is we want to try to keep them out of the hospital. So we encourage our people to call us directly before they do the 911, because we do have the capability to send a nurse to see them if it's necessary. Or we may advise them to go to the ER, or we will go ahead and let the office know in the morning, and they will get that individual in and see them for a sick visit. So in essence, what this program, how it works to help these people stay in the home, as they're getting older, we keep increasing what we have available to offer. So it will, like I said, in turn, enable these people to stay in their home for as long as possible. One of the things I want to just share is what's our team made up of. So the team is made up of doctors, nurse practitioners, physical therapists, social workers, dietitians, rec therapists, certified nursing assistants, and occupational therapists. So you're not just getting a new provider, you're getting this whole team that everybody's focus is different, but we're all here working together to keep their loved one in the home.
Now, all of this sounds so great. And the key kicker that everyone is probably on the edge of their seat waiting to hear is, how do you pay for it?
Okay. So PACE programs are only funded by Medicare and Medicaid. However, people that are possibly, which I do see, some of my 55 to 64-year-old clientele may only have Medicaid. Medicaid will cover those individuals at 100%. However, the Medicare recipient will only get covered a portion of the cost for the program. So we want them to get on Medicaid, which we refer to as dual enrollment. So those two sources provide the PACE programs with a capitated amount every month to take care of these individuals, and they do not pay any money to us. There are no co-pays involved. And another question that I do get asked quite a bit is, do we take private insurance? No private insurance. It is strictly Medicare and Medicaid funded.
So if someone doesn't qualify for Medicaid, because there are some strict limitations, and I know that there are attorneys, if you're right on that line, attorneys that can maybe help smooth that process along and give advice on how you can qualify for Medicaid. But let's say that's out of the question. You still want to be a participant. You can, right? Talk
Yes.
to me about what you would have to pay if you were not eligible for Medicaid.
Okay, so if you're only going to come into the program and you only have Medicare, then the copay into this payment, and this is just roughly because I think it really is driven by the diagnoses that the individual is brought into the program under, but it is roughly about $3,800 a month. Now, keep in mind though, because some people will say, well, that's a lot of money, but you have to keep in mind, this program is providing all of your care, from A to Z. So you're never liable out of pocket, even if you have a surgery, a hospitalization. We all know that that's going to cost well over $4,000. But we would not come back to that individual and say, okay, you have to give us X amount more money a month. It is a set amount that individual would privately pay into this program every month.
Now, I realize that a lot of people, or I should say a lot of people don't realize that you're also included as your dental and your vision. So is there anything else that you want to elaborate on? I know the socialization is so important, but even your podiatrist, like there's so much.
So we do, like I mentioned earlier, we're center-based. So you mentioned podiatry. So we do have a diabetic foot nurse that does come around to the centers, and she will do all of the toenail clippings. We do try to bring a dermatologist on site. They're very hard to get a hold of. So when we can, we do try to bring some of those specialists into the center to provide services. But especially right now with COVID, obviously we'd be sending everybody out if it's an emergency to see any type of a specialist. Now, vision and dental care and hearing, those are what I call some hot buttons for a lot of the folks that I deal with, because we know how expensive, especially dental coverage could be. So a lot of people will call and, right away they'll mention the dental services. So what we kind of advise folks is, when you first join our program, this team of individuals is trying to establish a baseline. So before we go ahead and offer any vision, dental, or hearing services, we want to make sure everybody else knows what the medical baseline is. And it takes roughly 90 days. And then they can put those requests in. This program is driven by our folks putting in what we call service requests for anything they feel they may need to us. So once they've hit that 90-day period, then we would certainly take them out and we would bring them to the dentist, and they can get their cleanings, fillings, and things like that. But if you get in this program and let's say within the first 30 days you have an abscess in your mouth, the team is not going to make you wait. We're going to go ahead and get that taken care of for you.
That's great. And I'm really, really excited that we're going to follow this interview tomorrow morning and have one of your participants on the show. That's going to be very interesting to hear her perspective. And I appreciate you running over there for me tomorrow morning to make sure she's on camera and comfortable. So thank you so much for explaining, briefly explaining what Hope Pace is, because we could talk about this for hours, I know. And if people have questions, all of your contact information will be uploaded and they can get in touch with you to talk about Hope Pace. So I just want to thank you so much for coming on the show, Miss Lisa, and I appreciate your time and I hope you have a great day.
Thanks, Amanda.
Bye-bye.
Bye.